What are the post-operative instructions after a face or neck lift operation? Whether you're looking to educate yourself about this procedure or you've already scheduled an operation with us, I will highlight some important information to remember as you embark on your surgical journey. I'm Dr. Rodney Chan, and I'm a STARS plastic surgeon in San Antonio, Texas. The information that I'm sharing with you applies if I'm your surgeon or if your surgeon is Dr. Davis, Dr. Granet, or Dr. Kunash. We have all agreed that following these postoperative instructions is important to optimize the outcomes of your face or neck lift operation. I will first go through some general instructions, followed by care of the surgical site, any restrictions on bathing or activities, and ending with expectations and follow-up visits. This information is also in print if you prefer to see it that way. Use pain medications that's prescribed when you're feeling uncomfortable. Constipation can be an issue with the use of any narcotic pain medications, and we recommend using a stool softener at the same time or using prune juice from the grocery aisle. Examples of stool softeners are Metamucil or Colace. You'll be able to drive after a week. Be aware that pain medication causes drowsiness though, and it should not be taken for a few hours if you're planning on driving. Even at home, you should use caution with tasks such as climbing stairs when you're taking pain medications. An occasional complaint after an operation involving general anesthesia is nausea. Taking pain medications on an empty stomach will make this worse if you are prone to this problem. This will generally pass within 24 to 48 hours. If you are very prone to this, make sure you eat something and drink lots of liquids after your operation. After your operation, you'll wake up with a bandage around your head. There may be drainage tubes inserted at the back of your head as well. The bandage on your head and the drainage tubes will be removed the morning after your operation if you stay in the hospital, or within 48 to 72 hours if you have your surgery done at our office operating room and go home. A lighter bandage will then be placed. On the first day after your operation, you may gently wash your face by patting it with a face cloth. You may also brush your teeth, and you may shower or wash your hair 4 days after your operation. Sleep with your head elevated on several pillows arranged in a wedge. For the first 48 hours, rest quietly with minimal talking or laughing. And you may get up to use the bathroom or take a light walk around the house. When you're bending down, try to bend your knees and don't bend down with just your head. Turn your head and neck stiffly as if a unit for the first 2 weeks after your operation, and avoid flexing or extending your neck as well. Do not chew any hard or tough foods for the first week after your operation. You'll be able to wear makeup 2 weeks after your operation, but avoid the sun for 6 weeks after. You must use a sunscreen with an SPF of 30 or greater for 1 year after your operation, and apply the sunscreen to your face directly over the scars. It is recommended that you continue to use the sunscreen for up to a year. It will be at least 2 weeks before you can begin light exercise, such as walking or using a stationary bike. Heavy exercise and heavy lifting are not permitted for 6 weeks. You will have some bruising and swelling on your face and neck that will take 2 to 3 weeks or longer to subside. As the swelling subsides, you will feel hard areas under your skin or face or neck. This is to be expected and will be resolved in several weeks. Your incisions may be raised, red, and feel hard for several months, but most incisions are inconspicuous after 2 to 3 weeks. Numbness in various areas of your face, neck, and ear is common and may persist for weeks or months. And you must be careful to use any hair dryer at this time so you do not burn your skin. It is normal to experience a feeling of tightness under your chin or behind your ears, and your neck may also feel stiff. The stiffness and tightness though usually last several weeks, but it will get better. The final results after your face or neck lift should be judged about 6 weeks after your surgery and typically not before. You will have several follow-up appointments after your face or neck lift operation. Your first appointment will be in 1 week if you stay overnight at the hospital, but if not, will be in 48 to 72 hours followed by 1 week. Your second appointment will be 2 to 3 weeks later, followed by an appointment at 6 months and then a year. We're of course happy to see you more often if there's a need. Thanks for joining me today. I hope you find this video helpful in your surgical journey with us. If you like this video, give us a thumbs up, subscribe to the STARS Plastic Surgery YouTube channel, or check out one of the other videos you have on your screen.